well. Entrepreneurship is alive and well in America, but women, and especially African American women, there's a huge opportunity for us to continue to start and grow businesses. Women start businesses, and we've seen an increase over the course of the last few decades. We've increased the number of women-owned businesses by at least 20%. And the growth of African American women-owned businesses is even more significant. But revenue growth with those businesses, we have not seen as much growth. So there's a huge opportunity, I think, as policymakers. There's a huge opportunity to make decisions that will really impact people starting and growing their businesses in your state.
I want to make sure that we get in before we turn it over to the audience is, can you all speak to the role of public policy as we are going forward in making sure that we have access in our communities?
I'll be glad to start with that. One of the important roles of state government that we want to mention is that it can expand Medicaid, which fundamentally expands access. It can help determine things in state government, whether or not private insurance reimburses for telemedicine, which can have a big impact in rural communities. Right now, Blue Cross is not reimbursed for telemedicine in Alabama. It does in Georgia and other places, but that's obviously could be a standard public policy. The Ron White Care Act, that's funded the majority of HIV care in this country since it was started, has taken this holistic view that we hear a lot about in the patient-centered medical care, but it's allowed us to help provide wraparound services like social work case management and transportation and funding for housing. And we have a food bank, and we have a Hispanic outreach worker. Things that can make the system work for our patients, but most private health insurance doesn't cover those kind of wraparound services, and we need to insist that they do, and that we don't lose those services with the Ron White Care Act. So those are a few examples of how public policy and state government can make an impact in healthcare.
So of course we can't say it enough, Medicaid expansion, but I think the other policy opportunities are workforce, looking at opportunities to leverage policies that will encourage more minority populations to go into the health sciences and health administration fields. I also think that when we talk about expanding Medicaid coverage and expanding access, you have to look at your policies around scope of practice. We don't have enough physicians. Mid-levels will be very important. Community outreach workers will be very important. And the third thing that I would encourage policymakers to look at is information technology, data sharing. It's very important when you talk about cost, when you talk about quality, when you talk about continuity of care, providers being able to share information, consumers having access to their medical record. Right before coming here, I was in Boston and learned that that state has instituted what's known as a locator registry. So the patient has the opportunity to opt in or out to allow for their medical record to be shared across providers, to be shared across hospital systems. And so sounded like, I think, a very good opportunity to explore in terms of making sure we've got the information that's readily available to ensure that we have quality health care delivered in our system.
Is my mic on? Yes. Okay. I'll just add to that, obviously the first cornerstone of access to care is having health insurance, and it's the Deep South states, by and large, that have not expanded Medicaid. We've got to have Medicaid expansion. As better than most, having a political voice is very closely aligned with having access to health care. Kentucky being the southern example with the Democratic governor that expanded Medicaid and has done a fabulous job of that. Our patient population is 47% uninsured, and we're able to help cover their care through the Ron White Care Act, federal money, but we're in danger of losing that because of the assumption that everyone has health care, that Alabama has not expanded Medicaid. The other thing, though, I believe is that health insurance is primary and key and cornerstone, but we still have the synergy of plagues that we need to address. And through the Run White Care Act, we're able to help provide transportation for our patients. If you have insurance, but you live in rural Alabama, where there's no public transportation system, there are very few primary care doctors, there are no HIV specialists, the stigma is so intense you don't even want to tell your family members. There are poor educational systems, you don't have the gas money to drive 2 hours. Having that insurance card hasn't solved the problems. And so we need to look at these structural violence, synergy of plagues, and do a much better job. And a lot of the innovative programs at this table are some of those ideas of how to address these other issues to access care. In our case, we're finding telemedicine to be very helpful to get specialty access. We have partnered with several of the community primary care clinics and put our telemedicine equipment in their clinics, and we send a traveling nurse. Our patient comes in to see an Alabama e-health specialist. The neighbors don't have to know it has anything to do with HIV care. They walk into the exam room and it tunes into our doctor in Montgomery, and they get their one-on-one HIV care from closer to their hometown. So both a political voice, expanding Medicaid being key, and then looking at the synergy of plagues of how we can address it.
So when I think about the challenges facing minority communities and access to care, I'd like to think about it in terms of 3 categories. Those 3 categories being financial, structural, and cognitive. When I talk about financial, obviously the first thing that comes to mind is insurance. Do I have an insurance card, and can I get access? Also, can I afford, even with an insurance card, my co-pays and my deductibles? And we all know that, again, I'm a hospital administrator to the core, so I'm talking about myself now. But healthcare is very expensive. Drugs are very expensive, so that's the financial piece of this. When we talk about the structural component, we're talking about access. Where are those community access points? How complicated, how hard is it to access an academic health center or any hospital for that matter? I tell everybody, and again, those of you in this room who know me know that I had a very close relationship with Lois Berry, and we consider ourselves to be fairly sophisticated, and we understand the delivery system. Don't walk into a hospital without an advocate. You need somebody there to help you navigate the system, because it is a very structurally complex system when we talk about the delivery system. The third component for me is cognitive, and that's health literacy. People don't understand, they don't know what it means when you've been diagnosed with this disease. And we as providers, we're not sensitive. Cultural competency is a big deal. And I don't care where you come from or what you think about it. When you talk about disparities, there are a lot of dimensions to the populations that we're talking about. And we have to understand those cultural differences. Those things that help me to understand that when I am in a room talking to a patient, I need to try to have some empathy as to where that patient's coming from. How they'll respond to that treatment, how they'll interact with that physician, who, you know, physicians and nurses have always been the captains of the ship. Well, now we're in an age of consumerism. Healthcare seekers are much more engaged, and for those who have limited access, we have to teach them how to interact and how to relate to your providers, and again, how do you navigate the healthcare delivery system.
But I think sometimes when you step outside of Riviera Beach or you step outside of your comfort zone, you encounter people who don't believe in you, who don't believe in your dream, who don't believe in the possibility of you. But you still gotta go find the strength to pursue your goals and your dreams. And I think for me, hard work, working hard, are the 3 key things that I live by. And it's PI. Performance, image, and exposure. I recognized early on in my career that I will not get extra credit for performing. Because guess what? If you're in the job, your boss expects you to do the job. So you don't get extra credit for performance. And I would say if PI equals 100%, performance is only 10%. 10%. Image is 30%. Image is if your name appears on someone's schedule and they say, oh great, I love talking to her, she's so insightful. Oh great, I love dealing with her, I get great ideas. Or, she's undependable. She doesn't work well with others. Image is your brand. You know, we are very aware of brands, whether it's red bottom shoes or a Starbucks coffee cup, or we're very aware of brands, but you as a professional, you as a person who's leading others, you have a brand as well. So what is your brand? And you should think about it that way. And sometimes we believe our perception, but sometimes our perception is not the same as the reality of how others see you. So it's tough sometimes to look at yourself through the lens which others see you. So I would say that the next big thing is exposure. 60% is exposure, in my opinion. I've been with NBC Universal for 20 years, and exposure is key. And now exposure, you might think you need to be in front of and have FaceTime with the president of the company. That may not be everyone's reality. But it's not just about the person with the big title at the end of on their card. It is also about the influencers. It is also about the people who can influence the decision makers. Imagine now if you were rude to the secretary or the executive assistant of the president of the company. Will you ever get on that schedule, really, again? So it's all about those things. It's managing your performance, it's managing your image, and it's also managing your exposure, you know, to the right people at the right time to let them know who you are and what you bring to the table. It's being able to tell your story beyond just your hard work.
The managing partner of Energy Works.
And I'm trying to figure out where to start, because you could tell I was ready to jump in. First off, in response to Gloria and to Paula, there are some complexities associated with this industry that can't be discussed in an hour session. You all recognize that. But what is really important, I think, and to David's point, is, in my view, a seat at the table.
There we go.
So you need to have a seat at the table to be a part of the discussion to achieve this the balance that you want to discuss. I know you all know our colleague, Julia Johnson here. She and I served as utility commissioners at the same time. And achieving that balance, or attempting to achieve that balance, was a part of our role as regulators. So this is the foundation for my engagement in energy. But I also want to talk about the importance of this equity question. I am obviously an advocate for solar, again, one of a number of renewable resources. And as we talk about advancing a clean energy and all of, in our view, the benefits associated with that, we still have to come back to the equity. We've all been involved in the incentives, the subsidies, the efforts to try to really push. Now, you know, I live in Nevada. And if you can't do something with solar from an economic development standpoint in Nevada, there is no place that you can do it. However, New Jersey is leading in the development and implementation of solar. So that means that policymakers are making a significant role, playing a significant role in how those policies are developed. So part of the answer to your question is making sure that you have well-informed, well-educated policymakers and decision makers. And we wanted to talk about job creation. Your issue, Gloria, around not messaging, we need to hire some brilliant African-American women communicators who can help us advance that message. We need to have some folks with degrees in economics who can come in and do the modeling that's necessary to show an example of the inequities that you're talking about. We need folks who can write the legislative language that's necessary to implement them. You follow me? This is a complex industry, but every single significant element is covered by, beyond STEM, because STEM is absolutely the pathway. But beyond that, we need to be promoting African American women to be involved in every aspect of this complex industry. That was my point. Thought I was going to take you on, huh?